So a steep jump in the number of people being hospitalized, treated in hospital for COVID-19 today, as Ontario's top doctor says the Delta variant is aggressive and we need to strive for sky-high vaccination rates to control it.
It bothers me deeply that the majority of these individuals continue to be individuals who haven't taken advantage of the immunization to protect them.
295 people are currently hospitalized with the virus. That's up more than 90 from yesterday. On top of that, 156 COVID patients are now in ICUs. Dr. Kieran Moore says as we continue through the fourth wave, these numbers are being tracked very closely.
At this point, with 156, we have capacity to be able to provide care to these individuals. It's certainly a key marker that we're monitoring, both the not just case counts, but the number of people in hospital, the number of people in the intensive care unit.
Ontario has hit a key goal with 75% of eligible people fully immunized. This was supposed to be the target that would allow a full reopening, but the Delta variant has complicated that. Dr. Moore now says we need to be above the 90% immunized mark to successfully control the virus, though he added that business capacity limits would not be tied to that benchmark, calling it aspirational.
It will protect all of us. It will reduce the overall risk. And instead of having waves that we're going to have to tolerate, we'll have small outbreaks that we'll learn to live with, that will have a smaller impact on the healthcare system, and allow us to start to pull away some of the public health measures. That could happen as early as 6 to 8 months from now.
Once again, Dr. Moore was left alone to answer questions about the healthcare system and back to school, with Premier Ford and his ministers noticeably missing from yet another COVID briefing. Aside from a keynote speech and a couple of photo ops, the Premier's last stop to talk COVID was at Ottawa Hospital about 4 weeks ago. Health Minister Christine Elliott also hasn't held a news conference since the end of July, and Education Minister Stephen Lecce's last announcement to answer questions about back to school was at the beginning of August.
I think there's a couple factors at play. Likely one is it's been a pretty intense level of work, I think, for all governments through this pandemic, probably 18 months straight with no breaks. Folks are now taking some time and taking a break to rest and recharge. I think the other piece is you have a federal election at play. And it's also very typical for premiers and mayors, if they don't want to insert themselves, they tend to kind of go dark or darker through the period of the writ.
A lot is happening. We are, supposed to be in this fourth wave right now. Is it not time for the premier, the health minister, the education minister to, make their presence known again?
I think certainly you'll likely see them in the coming weeks, probably poke their heads up a little more. I'm going to guess they're going to continue to have sort of the chief medical officer sort of lead the charge on communicating a lot of the pandemic measures as opposed to overly politicizing it, which has gotten this government in trouble in the past.
Now, there's still no information about Dr. Moore's prior comments regarding a grim fall and what that actually means, or when we will see the latest modeling. We did reach out to all three offices asking if the Premier or his ministers will be holding a pandemic briefing to answer questions anytime soon, especially with school just around the corner. We did not hear back in time for broadcast.